My name is Josephine Lang, and I'd like to share with you a wonderful old-time cure that's known as overheating therapy. Now, this particular therapy is one of those ones that you may want to have some expert advice about, and you certainly want to have an assistant for the bath. For the sauna, you can probably do it on your own. But you also want to make sure that your heart is in relatively good health so that you can tolerate these particular therapies. For the sauna, what you want to do is go ahead and take a sauna 2 to 3, maybe 1 to 2 times a week, so that you are, and you also need to make sure that the person can perspire yourself. Make sure that you can perspire. Because sometimes people, when they get ill, they lose the ability to perspire. So you want to, this therapy is only good for people who can actually perspire, because what you want to do is sweat those toxins out. The skin actually works like a third kidney in this situation, and it is actually removing toxins from the body, and it's stimulating the glands and the organs to release their toxins, and then they rise up to the skin and exit the body. So with the sauna, what you want to do is do it for about, like I said, 1 to 2 times a week and get good and sweaty. And then when you get out, it's a good idea to follow with a cold shower or a cooling shower so that you close those pores, so that you don't allow more pathogens to get in, because those pores are wide open. It's also a nice idea to follow up with a brisk rub down of the skin to brush any of those toxins off. So that's the idea behind the sauna, is to go ahead and let the toxins move out of the body. And the sauna is definitely the easier of these two. But now I'm going to describe to you the overheating bath. And the overheating bath is, you really do need to have an assistant. It's a good idea to have supervision. And the more expert the supervision, the better. So one of your friends who's pretty good with health and healing. And you'll need 2 thermometers, one that can be placed into the patient's mouth and one that the assistant is using to check the water temperature of the tub. And then you need a tub that's large enough to fit the person so that they can become completely submerged. And you want to plug the overflow so that you can get the water deep enough so that they really can become submerged. Now, it's all right if you want to have the eyes, the nose, and the mouth out of the water, or as happened with me when I did this particular overheating bath therapy, I submerged myself entirely and breathed through a straw. And it was a little tricky with the thermometer in and the straw and all that, but your assistant is taking your temperature to make sure your temperature is equaling the temperature of the water. And I did this because my father had had a quadruple bypass surgery, and I had gone down to take care of him and to release him from the hospital. I'd flown down on the plane and I picked up a virus, a bug, and I needed to stop that thing in its tracks, and I did, using this overheating therapy. And my sister-in-law helped me with it, and it's a good idea to have the help, because not only do you need the help with the testing of the temperatures and the water temperature, but when you're finished with this therapy, you are as weak as a kitten, and I could barely move. I'm a very strong person. I do my exercise every day, and I had to literally crawl out of the bathtub and crawl into bed. And then when the person gets into the bed, you want to line the bed with towels and extra sheets so that you can peel those off as the sweat continues to pour out of the body after the bath. But the way that you do this bath is you get the person into the tub, and you bring the water temperature, you have the water temperature of the tub at skin temperature, 98.6 degrees, normal temperature. And that's quite comfortable. And you stay at that temperature for 15 minutes. Then you increase the temperature in the tub by adding more hot water, and you bring you check the temperature of the person and you check the temperature of the tub. And they should both be the same, 98.6 for 15 minutes. Then you bring the temperature of the water up to 100 degrees. And no heat is escaping from the body because they are completely submerged. I found, for me, I tend to float, so I had to actually hold myself down in the tub. I actually used my knees and my hands to hold myself down with that little straw coming out. Actually, it was a big straw coming out of my thick, round one with a little amount of space for my air to travel through. Held myself down under the water, completely submerged. And what this does is it basically cooks you just like a fever does. And what a fever does is it stimulates the blood flow so that you're removing toxins and bringing more nutrition to all areas of the body. It also kills pathogens, and it inhibits the growth of virus and bacteria. And that's the whole purpose of this, is you want to really try to knock those bacteria, a good one, right in the head, and viruses. And that's what I did, because I believe I had a virus that I stopped. So this is sometimes been spoken of in terms of the morning after for a situation like AIDS. So it's a good viral stop it in its tracks type cure. But again, you need to have some qualified supervision. So then after you've come from the 98 100.6 degrees for 15 minutes, then the 100 degrees for 15 minutes, then you bring it up to 103. Now this is the temperature that will kill viruses, and most all viruses will die at that temperature. That's why we have fevers, is to go ahead and kill these pathogens that are inside of our bodies. And so after the 103, after you've done that 103 for a little bit of time, boy, that's when you're really weak. And again, you're using the thermometers in the water and in the mouth of the patient, so that you're being sure that you're really getting those temperatures just right. And then, like I said, line the bed with sheets and towels, help that person out of the tub. It's going to be a little tricky. If the person has some discomfort while they're experiencing the overheating bath, they can sit up for 5 minutes and then resume and go back down into the bath. And again, you want to have somebody who doesn't have a heart condition, whose heart is fairly stable. And I like to use this type of therapy for somebody who has good vitality. They've just been hit with a virus, something like that. And it will definitely clean the organs and the glands and help that person to heal. So may you use this therapy with good care. I learned it from Linda Page and her book Healthy Healing, her 9th edition. It's a wonderful therapy and one that I've used myself and to great effect. So, and please visit my website if you get a chance. It's stepintomagic.com, and enjoy your overheating therapy, and may it serve you well. Bye for now.